Hi, I'm Josh Ramirez. I'm the health director for the City of Harlingen. People are asking us where to go get tested for COVID-19. The only sites we have in the City of Harlingen is the University of Texas Rio Grande Valley here in Harlingen and at the City of Brownsville Sports Complex Testing Center. Who needs to be tested? You have to have symptoms, and if you think you were exposed to someone, we need to evaluate the amount of exposure you had. So it is best to contact your physician. He is a person who knows you the most about your health and your health conditions and will evaluate you and approve you to get tested. Symptoms can start with shortness of breath, constant coughing, high fever, and body aches. Those are the most common symptoms. For insured people, it's no out-of-pocket expenses. The insurance will cover it. For uninsured people, it's $110 unless they're qualifying under the federal funds, federal CARES Act that is covering the expenses. Best if you apply and qualify through their testing site. They'll have a questionnaire for you to enter and follow through, and then we'll determine the cost you will pay. Right now, we're asking people to think before just running and getting to get tested. Evaluate, do a self-evaluation. There's going to be a list of questions that you can follow through that we're going to putting out in these videos from these testing sites. They ask you simplest questions. Are you sick? What is your symptoms? Have you contacted your doctor to evaluate yourself? Make sure your doctor is aware of what you're feeling. Now understand that we're still in the allergen portion of the season as well. So it could be many other factors, and it cannot be COVID-19. So it is best to contact your doctor and have yourself be evaluated by your own physician first. We recommend everyone to wear a mask at all times as possible, especially in gatherings or going out to the store or speaking to someone. Always wear your mask. Places of work, always wear a mask. The virus can be picked up even if you walk into a room, could be lingering in the air, so it is best to wear a mask. Always wash your hands or disinfect your hands as much as possible. Social distancing does work. It is important to maintain a distance from the other person, minimal of 6 feet apart. As you know, the droplets that we spell out when we're speaking or coughing or sneezing could linger in the air. So it is important for us to wear a mask to protect ourselves. And while wearing a mask, we'll protect ourselves and others from getting contaminated as well. There are some private physicians that are offering the test, and there's also some pharmacies. Check with your local pharmacist, see if they have the test as well. All the labs right now are being overwhelmed with all this testing. Now, the lab has the responsibility also to process all the tests as much as possible, but also understand that we're going to focus, and the doctors are focusing on the critical ill. They need the positives as soon as possible to continue with the medical treatment that is urgently needed for that patient. If you're healthy, you're moving, and you have no symptoms, then consult with your doctor first before running to a testing site. It is, UTRGV is not serving only the City of Harlingen, it's serving the entire valley from Edinburgh all the way to Brownsville, and we're in the middle. And there's over a million and so many thousands of population. So they're processing everybody as much as they can. That's why we request that if you're not sick, if you don't feel symptoms, do not sign up for a test. Contact your doctor, have them evaluate you first, and then schedule yourself for testing.